Welcome, and thank you for joining us for Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. The purpose of these conversations is to provide health information from trusted voices in the Austin area. We want everyone in our community to have the knowledge to care for themselves in the best ways possible. If you are interested in learning more or collaborating with ABPA, please visit austinbpa.com to connect with us. That's austinbpa.com. Please enjoy and feel free to share this episode.
Thank you. I'm so glad that you're here joining us today. With us, we have Dr. Jessica Ohaju, family medicine doctor, here to talk to us about preventative medicine. Jessica, welcome. I'm so glad that you're here to join us.
Thank you so much. I'm so happy to be here.
So we're going to talk about preventive medicine, which is very important for the community, not just the health of everyone, but especially because there are health disparities within the Black community. And we're going to talk about some things that are important to prevent illness, to help people take better care of themselves. So let's start off by, let me just ask, what do you like sharing with your patients when it comes to information about preventative health?
That's a really good question. I generally like to share with my patients, it's so important to make sure that you're keeping up with your annual checkups. The reason for that is because it's really, really helpful to identify diseases and begin to treat them before they become more chronic. Chronic illnesses are a lot harder for us to treat and to manage. And so these preventative screenings are all about catching things before they, essentially develop roots and become a lot more difficult to treat.
That's a great point. I take care of mostly 11 to 25-year-olds. Who is most of your population?
Most of my population right now, I take care of usually adolescents to the elderly population. So anywhere from 11 to, I think my oldest patient is 94. So
And so I imagine your advice is different depending on the age group. So let's start young, with the people who we both work with, the adolescents. Some of the preventive things I talk about always have to do with accidents and injuries, because that's one of the most common issues with young people. What are some of the things you tell young people about preventative medicine, preventative health that they can do?
yeah, for my younger kiddos, it's a really, really important age group to screen for depression and to screen for anxiety. Kiddos nowadays are dealing with um, a lot of stressors with school, bullying, social media, and things like that can can essentially build a lot of symptoms of depression. And so identifying that and giving kiddos resources for managing these things is really, really important.
That's a great point. COVID and back to school has been stressful for a lot of young people. And I always talk about the things that just go along with good health, eating right, sleeping right, exercising,
Absolutely.
and having someone to talk to. So, part of my preventive medicine is making sure that every young person I talk to has at least one adult that they feel like they can talk to. You mentioned screening tests. Do you do this through a computer? Do you use paper? Do you find one way better than another? Or do you just talk to them about things?
Usually we'll start with a simple questionnaire. That's a really good place to just identify a couple of different issues, and then from there, we'll have a chat and kind of expound on some of the things that were picked up on the questionnaire.
So to me, I'm hearing the take home message is talk to your doctor. If you have things going on, if you're worried about things, your doctor's office is a perfect place to share that information.
Absolutely, it's a safe place. Generally, unless there's concerns for self-harm, what we talk about stays in the office.
Excellent. So let's move to more middle age adults. What are some of the things that you like to share with adults at the end of the visit or even during the visit to help with preventative health, preventative medicine?
Well, um, during the visit, I like to, as far as general things that we like to talk about, I like to talk about following a healthy diet and making sure that patients are getting routine exercise. As far as exercise goes, the recommendation says, 30 minutes of some form of moderate intensity exercise 5 times a week. Um, Sometimes that can be hard for people to do, especially people who don't really exercise at all. And so I say, do what you can to start with. Start with, 30 minutes once a week, and then gradually build from there. It's essentially all about building healthy habits.
I really appreciate you acknowledging that it can be hard for some people. Like if you spent most of your life not exercising, to ask someone to exercise now 5 times a week is a pretty challenging task. Some of the things that I talk about is just having a walk around the neighborhood if you feel like it's safe. People with dogs, they have to walk their dogs, so that's a way to get some exercise in. And I've even started talking to people who actually clean and do construction work and do manual labor and help them realize that that's a form of exercise. If you're working up a sweat while doing your job, you're exercising.
Absolutely. And another thing too is a lot of times people think that they have to have a gym membership or something to that effect in order to exercise effectively. I like your idea of walking around the block. One thing that I tend to recommend to people is YouTube. There's so many, quick little workouts on YouTube. A lot of them don't require any equipment. And so yeah, that's another resource that I tend to plug to people.
It's good. You know, a lot of times these exercise routines say consult your doctor before starting on an exercise regimen.
Yeah.
What would they hear from their doctor that might tell them that maybe that's not the right exercise routine for them?
Well, generally, if there is, any concern for heart disease based on, um, personal risk factors that the patient may have, or any symptoms that the patient may have, things like chest pain or shortness of breath with exercise or with exertion. These are some of the things that the patient would need to, have a chat with us before performing any type of exercise like that.
Great. So I hear again, you're recommending to make sure you talk to your physician, your provider, just when you're thinking about changing those healthy habits or increasing your healthy habits, having someone to bounce off what your goals are is really, really important.
Absolutely.
Now let's focus a little more on the Black community. Now we're not a monolith. All of us are very different. Some come from immigrant parents, some have been in Austin for their entire lives, other people have come here from other places. Are there cultural differences that might come into play when you talk about these healthy habits and preventative medicine for your patients? Put it this way. If I was a patient in front of you, a Black person, and I said, Doc, I don't think I can do all that, what would you tell me?
Well, I guess I would inquire why. What makes you think that you can't do it?
And I might say, you know, our people, we like what we like to eat, we do what we like to do. I don't know if I can get a gym membership. I don't think I can do all the things that you're talking about.
Well, I would say, I definitely hear you. I definitely hear, what your concerns are. Um, but I would tell you it's possible. It's you definitely don't need a gym membership. Um, I know that a lot of our foods tend to be, a little bit more on the rich side and tend to have more salt. But I mean, there are substitutions that we can make in our foods to make them healthier. For example, instead of adding salt to our foods, we can add, various seasonings instead and different spices instead to make the food more flavorful still um, without having all of that extra salt in there. And, as we know, with you know, added salt can lead to higher blood pressures and hypertension, and that can lead to further health effects. And so small changes in food can be helpful.
Great. Fantastic.
It doesn't always take a lot, all that to say.
Yep, that makes a lot of sense. So let's move on to our older patients. A lot of times it can be challenging because you had a whole lifetime of habits and things to work against and to try and change. What do you tell your older patients about preventative medicine? What are some things that say your senior citizens really need to do to stay healthy?
I mean, it all goes back to the lifestyle as far as prevention goes, and as far as what they can specifically do to help. Um, Lifestyle meaning, again, diet and exercise, making sure that they're following a very balanced diet, higher in fiber, lower in salt, lower in fat and saturated fats, and um, maintaining an exercise regimen. Again, anything from walking around the block to weight bearing exercise, very light hand weights can be helpful. Additionally, well, actually, yeah, that's it.
Fantastic. Do you give any restrictions to your older patients? Is there anything that you tell them to avoid?
Um, I don't give very specific restrictions generally. I don't know that there's anything that they need to avoid specifically. Generally, I tell people as a rule of thumb, do what you're able to tolerate. So, I'm not asking anyone to run a marathon, but if you're able to tolerate walking around the block a couple of times or walking for 30 minutes a day, then do that. If you're able to tolerate, something a little bit more exertional, walking on the treadmill or doing light weights, if you're able to tolerate that, then do that.
Fantastic. And one important preventative health measure that we do in the medical community is the immunizations. Now there have been new ones. There are ones that are geared for each age group. What's your general impression? What would you like to share about immunizations?
Certainly. So, in the pediatric and adolescent age groups, vaccines are huge. We tend to vaccinate commonly against things like tetanus and meningitis and pneumonia, HPV. These are more commonly done. Now, I find that as people exit the school age, it's a little bit more difficult and challenging for them to remember to stay on top of vaccines. In the adult age group, certainly tetanus is important to do every 10 years. It's important to have a tetanus vaccine. Of course, in light of the pandemic, it's important to make sure that everyone is up to date on their COVID vaccination series. In the age group of generally 50 and above, shingles is important to be vaccinated against. And then starting at 65 and above, pneumonia vaccination is very important as well.
Great. That's a fantastic summary of the immunizations. And I agree, they're so important. It's one of the best things we can do to help prevent some of the diseases.
Mhm.
All right. So as we start to wrap things up, is there anything else that you want to talk about when it comes to preventative health, preventative medicine, things that you would like your patients to hear from you?
Definitely. So just another component of preventative health is just your routine age-related screenings. For example, in young women, ages 21 all the way up to 65, we tend to screen for cervical cancer. So that's another reason to keep up with your checkups to make sure you're being screened adequately for that. And so screening for cervical cancer excuse me, let me rephrase that. Screening for cervical cancer should occur every 3 to 5 years, depending on how the test is performed. And then your doctor will talk to you specifically a little bit more about that, which interval. Other age-related screenings Colon cancer is another really, really important thing to be screened for. We tend to screen for colon cancer with colonoscopy is the gold standard. And then another way to test for colon cancer is going to be with a stool sample. And so that's another important thing to talk to your doctor about to decide which one of those tests is going to be the better option for you. Another screening that we tend to recommend is breast cancer screening, and that's going to be accomplished with your annual mammograms. And so generally between ages 40 all the way up to 75, we'll do the annual breast cancer screening through the mammograms as well.
Fantastic. I'm so glad that you mentioned all these cancer screenings, because that's a big question and a big fear for most people living today, the worry about cancer. I also appreciate that you didn't talk as much about risk factors. While we do care about risk factors, if you have a strong family history, you absolutely should get screened more often. But a screening exam is really made for everybody. And talking to your physician, talking to your provider about what test you should get screened for, depending on your age, depending on your risk, is really, really important. So thank you. The other cancer that's important for men, prostate cancer. And there's a blood test for that. And that's something that we as men should think about talking to our doctors about also.
Absolutely.
Great. Well, I appreciate your time today, Dr. Ohadu. You have been wonderful, and our audience, I'm sure, appreciates the information about preventative medicine. For those of you watching today, thank you for tuning in. If you want more information, if you have questions you want us to address in particular, please reach out. Please go to our website, austinbpa.org, and drop us a line.